Welcome to the Empowered Patient Podcast. Today's show is all about health disparities and chronic disease in Mississippi. And we have a special guest with us today, and we will be really discussing the impact of health disparities in the South, specifically Mississippi, how that has evolved from the inception itself, the history of it, and how has that evolved in modern day healthcare. And we have with us Dr. Michael L. Jones, and he has spent tremendous time in Mississippi caring for patients who need care, who need access to healthcare. And usually those patients are oftentimes underserved. So he's going to be sharing his perspective on increasing access to healthcare and really affecting change in Mississippi. So Doc, welcome to the show.
Thank you, and thank you for having me.
Hey, I wanted to really get through a bit about your background so that our audience get to know a little bit about who you are and what you represent.
Okay. Of course, I am Michael Jones. I am a lifelong Mississippian. I've been in Mississippi all 43 years of my life. I've been a registered nurse for 20 years now. I'm a fairly new PhD in nursing, so I actually just defended my dissertation to become PhD on March 25th of 2020. I have an extreme passion for ensuring that the poor and underserved have adequate access to healthcare, thus addressing health disparities. I also have a keen interest in ensuring that individuals are properly educated around some of the issues of chronic disease. I am a firm believer research has shown that when health literacy is not there, individuals suffer greater with chronic diseases. So saying that, I have an extreme interest, a keen interest in addressing health disparities through the lens of addressing the social determinants of health, and also health literacy being one of those determinants that I think kind of drives whether an individual is going to be healthy or well. As I stated, been a registered nurse for 20 years. I've worked in various capacities in healthcare, specifically in healthcare administration and also healthcare education. Not only on the nursing side, but I've also taught actually in healthcare administration. I actually teach for Jackson State University now in their School of Public Health. So really enjoy educating minds, because I think we're kind of in interesting times right now in healthcare with COVID-19. We're going to need individuals educated in public health to be able to make a difference in the communities. And, public health will never be the same. So I'm just truly honored to have served in that capacity to educate the next public health officials that are going to be addressing all of the public health issues that we're facing in our country, such as COVID-19. So that's kind of a brief introduction of myself. And I, again, very honored to be here and look forward to the dialogue.
So he has just quite an extensive background given from a patient care point of view and administrative point of view as well, in the hospital settings and outpatient settings. And one of the key things you had mentioned was the fact that health promotion is a big component of who you are. So how do we educate? How do we use education to really affect change as it relates to chronic disease?
I think we have to meet people where they are. I am such a huge opponent of having canned educational materials that we give to patients. I think that we have to address health education through first assessing that individual's capacity to be able to process the information that we give them. I think it doesn't do us any good to provide health education materials that person really can't understand those words. And as such, I think we have to kind of understand where that person is and look at that individual's health literacy and provide that healthcare education or health promotional education in a way that person can understand, process that information, and put it into practice to best benefit themselves. For example, if that person is suffering from diabetes, hypertension, how can we best put that in terms where that person can understand it and then be able to translate it into their own everyday lives? I think health literacy is the best way to approach health promotion around chronic illnesses, especially in a state like Mississippi, where literacy rates are, are fairly low as compared to other states in the union.
So you mentioned some really key points there that simplify the message to be able to reach
Yes.
the target audience. So in terms of a patient who might have diabetes, right? And their first steps are usually what? They discover they have the pre-diabetes or they're diabetic. What are usually the first few steps they must take, right? What are usually the recommendations that you see among yourself, recommended to patients how to stay healthy, right? With health promotion, what are they? What are the first few steps?
I think if we look at diabetes, I think the first step is getting that person to accept the fact that they have that disease. I think that comes through healthcare professionals. And, myself, I've been a registered nurse, and when you look at it in the full scheme of things, a lot of times we don't have a lot of time with that patient. If we're in a clinic, we may have 15 minutes with that patient, and we send them back home. And a lot of times we send those individuals back into the environment that's making them sick. So I think we have to have time to allow that person the opportunity to process the fact that they have that condition. And then number two, I think we have to make very, very small steps. We need to do an assessment of what's going on in that person's home environment. Do they have access to fresh fruits and vegetables? Does that individual understand the difference between a vegetable and a starch? For example, where I come from, we eat butter beans, peas, corn, things like that. I was taught as a child that those foods are actually vegetables, but in actuality, they are starches. So we have to ensure that individuals have an understanding of just basic things like that. And if there are things in that person's environment that we can assist them in modifying, I think that is the very first step. But I think first getting that person to realize the magnitude of that disease that they have and help them to understand what they need to do to manage that disease. Because we as healthcare providers, we don't manage disease. We monitor that person's progress by them managing their own. And I don't think that we've done enough in a state like Mississippi and nationwide, to be frank about it, about how to go about providing that educational piece to those individuals who are diagnosed with chronic diseases. We'll give them information and we just assume that they understand what we're talking about. And then too, I think we also have to take it a step further. How can we utilize community health workers, community health advocates? How can we utilize a faith-based entity to provide that ongoing communication and education with that person, when we can't just wait for that person to come into the doctor's office in March, and then maybe their follow-up visit is in April, and expect that person to come back with their hemoglobin A1Cs or their blood sugars within normal. We need to put some things in place while that person is at home, so that there's an ongoing education, that ongoing assessment of that person's need, ongoing assessment of that person's level of understanding, and then be able to put some interventions in place before that individual actually comes back to the doctor for their follow-up visit, as an example.
Which make a lot of sense. So it's really proactively teaching and educating the individual, using community health workers to be able to execute what is passed down from a knowledge point of view and hold that patient accountable. So it's not just education; it's accountability. Both of them working hand in hand together to keep that patient super healthy, right?
Right.
So when we then look at the South has had a history of wheeling up individuals like myself that live in the South not having access to care. And they go back to really dark history. And of course, Medicaid expansion there has been a big issue. So what are your thoughts around why hasn't the South, African Americans living in the South gained access to care that they deserve? Why has that been such a struggle?
Well, first of all, I'd like to say, and I'd like to also recognize that we are in a very different place than we were before I was born in the 60s, 70s, when segregation, racism was at an all-time high. Yes, those issues still continue to this day. We still face racism in a state like Mississippi. I want to first acknowledge that we have come a long way, but there is a long way that we have to go. But I think some of those issues still persist in Mississippi because, I mentioned those social determinants of health. Which are those things that kind of dictate how we will fare in life as it relates to our health? So a number of things that you have to consider. I think number one, when you have a place like Mississippi where we're at the bottom of the list, I think a lot of times related to education, there's a direct correlation between the educational system and the overall health outcomes of individuals. I think that's number one. Number two is geography. I think Mississippi, I know Mississippi is a very large landmass. We have 2.9 million people peppered across a very large landmass. So gaining access to those very rural areas of our state, Mississippi is largely rural, have one urban center in our state. So gaining access in those very rural areas becomes a challenge. Number one, it is very hard to recruit physicians into those very large areas. And then number two, transportation becomes an issue because if an individual has to travel 30, 40, 50 miles to the next doctor's office, that becomes a major issue, and it impacts the individual's ability to get good quality health care. Also, we have food deserts all over the place in Mississippi. There's individuals who have to drive an hour to get to the nearest grocery store, have to drive 30 minutes to get to the nearest grocery store. So if those individuals don't have access to not only health care, but also have access to those things which helps to make them healthy, that helps to kind of exacerbate that issue of chronic illness that we face here in Mississippi, that we're at the top of the list in. For example, hypertension, we're usually at the top of the list with obesity, diabetes. And then poverty is another issue I think that has kind of persisted in Mississippi. And that also goes back to the educational system. If you have a community that's not properly educated, you're going to have more poverty. And research has shown that those individuals who live in extreme poverty usually have the worst health outcomes. I could go down that list of those social determinants and really apply it to Mississippi. But for the sake of time, I'll just kind of focus on those main ones. I think education, I think the issue of poverty has helped to, prolong that chronic disease state in Mississippi. The issue of transportation, geography, and also the inability, as I forestated, to recruit quality healthcare providers in some of the most rural areas of our state. And then too, I wanted to also acknowledge that we do have a good healthcare system in our state, but it may not be enough. We have a good system of community health centers, also known as federally qualified health centers, that are there for that purpose. And they do a magnificent job when they're properly funded in some of those rural communities of Mississippi. But as I forestated, we still have a long way to go to get Mississippi to where it needs to be.
That's interesting. So you mentioned really some of the key components of the inequality to gain access to care by us. And part of the big reason is you got to have healthcare workers to want to live in Mississippi. You have to have doctors that want to live in Mississippi. So how do you incentivize? How does the state government incentivize healthcare workers to move from a different states? Say a neighboring state would be Alabama. So say Georgia, for example, another state in general. How do the state government work hand in hand to incentivize healthcare workers and healthcare providers to move to Mississippi? What are the things that are in place?
Well, one of the things that Mississippi has done a few years ago, and I can't remember the exact date that it happened, it's been quite a while, but the Mississippi State Legislature did allocate funds through the University of Mississippi Medical Center, which is the only teaching hospital academic medical center in the state of Mississippi. So what they've done is create a program, the Growth Physician Scholars Program, where they actually recruit individuals from the smallest towns, some small towns throughout Mississippi, and they'll pay tuition for those students, and in turn, it provides scholarships and funding. And in turn, those students are required to practice, and I can't remember the number of years, but they're required to practice for a set number of years in the community in which they come from. And I think that's going to be key going forward. Once we can get some years and get individuals graduated out of medical school from these communities, I think that's one, and I think one key area that our federal, not federal, but our state government has done to address that issue of having healthcare workers. I think it's going to be very important also to pull people from those communities, to give them resources, because they know the culture of that community. And just another thing that I wanted to mention too, not only physicians, I think it's going to be key, but I think our governments, our communities, our state leaders have to embrace the concept of having community health workers that are used to kind of bridge the gap between when that individual comes to the doctor's office for the initial visit and goes back. So, and I think there's kind of been maybe some misconception about what community health workers and advocates do, but they are a very necessary, a necessary component of that healthcare team. And currently in Mississippi, we don't have a certification process for community health workers. So, in addition to what the state is already doing, what they also could do, I think, to make this more efficient is to provide a certification process for community health workers to kind of serve as that bridge, as that liaison between the patient and the healthcare provider. And what I mean by that liaison, for example, the healthcare provider may not understand the culture in which that individual comes from. So that individual who serves as that community health worker is a liaison in that they have the ability to communicate with the physician and also, and then in turn, translate back to the patient what that individual, what the physician is saying, and then vice versa, translate what the patient needs back to the physician. So I think that's one thing that's missing in healthcare, from my opinion, that we really need to address healthcare when you look at the need for healthcare workers.
Which makes sense. So it's like you have to really look at hyper localizing the solution. And part of hyper localizing the solution is to ensure that those in the community that understand the struggles of those patients, i.e. transportation, food desert, that understand those social determinants of health that affect that community, embrace them, give them a certification for them to be able to earn a living, right, to do the work. Part of the process, reimbursement, right? The patient, the provider, the healthcare provider can get reimbursed for those services provided to the patients. But what I'm hearing is in Mississippi, the community health care workers may not have that reimbursement capacity.
It's not.
And that is policy that should be changed, because then that incentivizes that individuals to want to work in the community healthcare space, not for free, but to have at least an affordable living to take care of themselves and their family, while really working as an advocate for the provider. Part of that, really working as an advocate, is recruitment as well, right? They go out there in the community and recruit those patients, and identify those patients, and actually the patients that, hey, it's okay to trust that provider. They're here for our best interest. They're just not here to use us, right? Because that's another thing that in our communities, we really don't trust healthcare providers for good reason. Correct?
Right. That's correct. And one thing I wanted to add too is that, and what that does, it helps to empower that community. It helps that community to be empowered because you have individuals that you can relate to. It could be your fellow church member that's assisting you with helping to navigate through that health system. It could be your brother, it could be your sister, but that helps to empower that community to think more in terms of of being healthy and well, not so much episodic care. But, I like to say we have a sick care system. We only think about healthcare when individuals get sick. So it helps that person, that community, to be more empowered, to be more proactive. And also, and this kind of key goes back to your question about, Mississippi's past, our history of racism, segregation, all those things. That helps to build trust in communities. I have a lot of older family members that are still living now. And for the most part, to listen at them talk, there's still a mistrust from, a mistrust of healthcare providers. The issue with the Tuskegee Airmen and the syphilis thing that happened, back then. People still remember that research study that happened, and they think that healthcare providers are there to experiment on them. So we have a job to do with building trust in communities, and I think, like you said, localizing healthcare also helps to helps to improve that trust that individuals and communities have with healthcare providers, which I think is also an issue that I failed to mention earlier.
Which is a very important issue. And I think you had won recently in 2013 an award for excellency in health promotion. So part of that really, and I love how we've got a chance to meet is you posted something, and I also follow you on LinkedIn. You posted about your garden, right?
Yes.
And which is, if you don't mind sharing, what made you begin gardening?
So it goes back to the history of my parents. Both of my parents grew up in the 50s and the 60s. And during those years, and actually before then, a lot of African Americans' families were like sharecroppers. So after slavery, a lot of those individuals who were enslaved actually stayed on the plantation. What I mean by sharecroppers, they helped to grow the crops, for that white plantation owner, and they quote unquote shared in the proceeds of the crops. It was not equal in the way the proceeds were shared, but they did stay on those plantations to grow those crops. Both of my parents grew up during that era where their parents lived on someone else's property and helped with growing the crops. So they kept that tradition alive throughout my childhood of growing gardens. And so I learned how to grow a garden actually growing up as a child, because we were required to get out and grow our garden. So a few years ago, I kind of took a change in my career. Actually, 3 years ago now, I was working from home for an insurance company. I found myself having a lot of time, on my hands. So I would do a lot of work in my backyard. And so one day, a bright light came on and said, "Hey, you could be growing your own crops. You got this space here." My mind went back to when I was a child. So I started out by raising kind of a raised garden. It started out just by 2 little 4x4 areas, and then that kind of expanded. So I got about 7 4x4 areas in my backyard now. But it all goes back to my childhood and being required as a child to work in a garden. So I've kind of kept that passion alive. I've restarted that passion into my adulthood.
That's amazing. That's amazing. And that's a rich tradition itself. And it goes to show that healthcare really starts at home. It's the food we consume.
Right.
It's the information we input into our mind. So whether that is, how do you cope with mental health? Because we're going through it right now. If you're not,
yes,
if you're an African American, you're exposed to the news daily. And if it's not COVID-19 affecting us, disproportionately, it is police brutality.
Right.
And you go back to the South. The South has a history of that, especially the policies around not passing Medicaid, making Medicaid more of a wide expansion strategy, right? because Medicaid allows for poor, poor communities that can afford health coverage to be able to have access to health care. But stipulations through Medicaid in the South haven't really allowed for that in some states. And why does that continue to persist? Especially in a time like this, that we need mental health, right? We need health promotion in terms of food, nutrition, food desert, right? Growing a garden like you have. And it's great. It's so great that you have that knowledge. What if someone else doesn't have that? How do we ensure that expansion strategy of Medicaid becomes a norm in the South?
I think for us, I think what we have to do is to educate our policymakers. We need to educate our policymakers a bit more. I think also, and at the same time, and I think what has not happened for the most part, and I always say this in meetings when we're talking about Medicaid expansion and so forth, you know, our legislators, they look for and they expect people like our various nursing associations, the various fraternities, sororities, all of these advocacy groups. They look for those groups to come each year. They'll do their spiel. They'll set up time down at the state capitol. They'll set up tables. They'll meet with policymakers. But I think the thing that has not happened on a larger scale than I would like to see, I just don't think that we as healthcare leaders and healthcare providers have done enough of activating persons in those communities to be more socially involved in a lot of these policies. Because when you look at it in the full scheme of things, Mississippi is a state that is very connected socially. And a lot of our life in Mississippi revolves around our church, our religion, and also around sports. So if we could get individuals in communities to be more vocal, to be more active, at that level, because a lot of these, most of them, legislators in Mississippi come from very small areas. So if we could get that person that attends church with that healthcare provider, or that individual that's a part of the same civic group as that not healthcare provider, as that legislator, having them also reinforce the message that a lot of our groups are doing, I think we could make a bigger impact. But I think we have to convince our legislators that it is going to be more beneficial to expand Medicaid than not. And how do we do that? You know, a lot of times legislators speak in terms of economics. You know, if we can show them that it's going to impact our economy, I think we might be able to get more movement. And maybe not. You know, maybe some of them just have their mind already set that we're not going to expand Medicaid for this reason or that reason. And I think what we have to do is do our due diligence in understanding how to best get that message over to that policymaker, because all these policymakers, there's probably a minority of them that actually understand healthcare. You know, you might have attorneys, you might have individuals who come from a business background. How can we translate that message to where they can understand it and get the full picture and turn that bright light on in their head? Hey, it would benefit us better to expand Medicaid than not. So, you know, I've kind of, gone through a lot, but I think there's a lot of things that we should do in that area, but we still have a long way to go. We have a long way to go. There's a lot of work to do.
And I mean, it's so critical. What I'm hearing is ensure that people of power and influence be the voice that empower the community to go out there, vote, get the right people in place that will affect policy change. Secondly, is to be able to identify that this is a long fight for Medicaid expansion. And Medicaid expansion itself really does increase access to care. We know this for economically. We see in when the Affordable Care Act was passed, 2.8 million African American gain access to health coverage. out of the 20 million that gain access to health coverage due to the Affordable Care Act, right?
Mhm.
So provided that that is the case, economically it makes sense. If on a singular person, if I am healthy, I can get up in the morning, I can go to work. If I have employment, I can go to work because if I'm healthy, I can go to work and be a productive member of society and earn a living to pay for my healthcare costs. So my healthcare costs, as in return, actually decreases if Medicaid expansion increases, right? And then of course employment comes into place too.
Yes.
So really being able to explain those terms that economically it does make sense when you increase the well-being of society in Mississippi,
Yes.
people are a lot more happier and they want to be a productive member of the society and go for employment. But you can tell them, hey, you can afford healthcare, so we're not going to expand coverage because you might abuse it. That's their thought process, which is really not true. Because it's clear that it's a healthcare they need. Healthcare they need. It's not a want, right? It's truly a need. It's not like, okay, well, I want to go see my doctor. No one wakes up in the morning and says, I want to go see my doctor. It's like, I need to go see my doctor. But we want to get into a habit. What I'm hearing as well from you is we want to get into that habit of preventive care. I want to check in with my doctor, right?
Yes, and that actually saves millions of dollars, because I always like to make the analogy that it's more cost effective to prevent diabetes than it is to treat kidney dialysis and amputations that are and stroke that are a direct impact of diabetes. And we have to find a better way of getting that message over. And I know that there's groups out there that, they might listen to this and, well, we're doing this, but I do think for the most part, we have some groups that are doing it, that are, that are getting that message over. But I think we have to empower those folks at the grassroots level in those communities, get them involved as well to help us to carry that message.
So how do we scale the efforts of those individuals, right? One is we have a transportation issue. We have lack of access to healthcare providers, quality healthcare providers. But the few that take the opportunity and the challenge to go and move to Mississippi. I think there was a doctor out there, right, that took the challenge to go to Mississippi and care for patients who have lost their limb as a result of diabetes. They've taken this challenge, but what I read and I think what you shared with us is that some specialties don't get the more of the subsidies, right, that are given to like a family care provider. So how do we ensure that how do we scale the work of those individuals, right, that are actually taking up this challenge?
I think there has to be a vested interest in that community or a vested interest in coming to a state like Mississippi. I think that's one of the purposes of our state putting into place that rural health, the rural physician scholar program, to where we can actually pull folk from those communities who know that community and who we feel like would be interested in going back to that community. So I think to address that issue, also getting specialists accessible to those communities, I feel like we have to grow those specialists, also those primary care providers up in those communities and pull from that community and then educate those individuals and send them back and with the hopes that individual will be there long term because they have a vested interest. They know that community, they know the culture of that community, they are of that community.
So how do we use technology to scale the individual's efforts? Because clearly, say the provider may come in, they may not want to move, or they just want to come to Mississippi 3 or 4 days a week to provide care. How do we scale that effort using technology?
I think it's going to become necessary now with everything happening with COVID-19 and social distancing. Healthcare will never be the same. And I think the first thing that has to occur in communities, since Mississippi has a very rural community, a very poor community, we have to change the mindsets of those patients or individuals who are living in communities. Change that mindset. What I mean is to be more acceptable of getting their care via telemedicine or via through the use of technology. It's okay. It's, Mississippi University Mississippi Medical Center is at the forefront of telemedicine in the state of Mississippi. That's all fine and well. But if the community is not accepting of it, it's going to be of no benefit at all. So I think the very first step that we need to do is to get people in communities more relaxed, get them to be more acceptable of getting their care through telemedicine, because it is necessary, and that's another way of getting specialists into some of those rural areas. In addition to growing up healthcare providers in those communities, we have to make technology acceptable there. But I think the very first step is to getting that community to buy into that use of technology. And I think what that's going to take, it's going to take religious leaders, because as I stated, Mississippi we're centered around church, we're centered around things like sports, we're centered around other social activities. Those religious leaders, those local elected officials, folk like myself who are from a very small town, I'm a healthcare provider. So we've got to be preaching that message of the use of technology to get individuals more acceptable. And I think also funding too is very important. We have to ensure that our state's Medicaid, that we have Medicare, the insurance companies are actually reimbursing for telemedicine or telehealth services to have healthcare delivered to these communities via technology. So there's a number of things that we have to do, in that regard.
Which makes sense. So reimbursement is a key component. I think we're talking about making sure that the community health workers have a certification so that they can get reimbursed, right? We've talked about reimbursement in person for healthcare providers, which makes sense, right? They provide a service, they get reimbursed for that service. Right now, it's really a push towards certain states as well to get full reimbursement for in-person visit, as the same as virtual visit. Some states are pushing towards that. Some states actually have implemented that here. The same cost that you will get reimbursed for an in-person visit is the same as a virtual visit, because you're providing that care. But one thing that comes to mind too is using those community health workers as health coaches, for example, right?
Yes.
Be able to provide that care virtually, check in, right? You can check in virtually with the patients and say, hey, you're taking your medication. You can use those notifications to tell the patients, hey, this is the amount of medications that you need to take to be able to get the proper care, right? And then use them to say as accountability, regular checking with them. Where are you with your food? You discussed about the difference between a vegetable and a starch, right? Why that is important. But using individuals like that as health coaches, that allows the process to be scaled. So how do we simplify that process? I know we're at End of Cares, that's our mission. That's what we do, right? But it's like, how do we ensure that the adoption, it's key that you mentioned, right? How do we ensure the adoption is received by the community?
Right. And one thing I did mention, and you hit on it, I also think that community health workers, it's going to be a system. There has to be a whole system created with different individuals from various disciplines taking part in that system. It has to be a multidisciplinary approach. So that community health worker is going to be key to assisting that person that's sitting in that very rural area, that's out in the woods somewhere, to navigate that healthcare system of the use of technology and telemedicine. It could be just a simple fact of that community health worker taking, given that the bandwidth is there and the community infrastructure is there. And that's another thing. I think the infrastructure has to be built up to be able to support the use of technology. There are areas in Mississippi that don't have really good internet have really good internet services. That's another area I think we have to be mindful of as well. The environment of the communities have to be built. Infrastructure has to support that. But it could be a situation where the person can take an iPad or an iPhone, because all the iPads, iPhones have cameras on. They can do some wonderful things. Could be something like that, where that community health worker takes it to that person in the community. So in essence, you're taking that specialist to that person's home. Or it could be that local community health center or federally qualified health center, as I mentioned, having a TV monitor or a tablet or something there to beam that person to Jackson, Mississippi, which may be 3 hours away from any community on any given day. So I wanted to mention that as well, that having that liaison there and it working as a system to ensure that healthcare is delivered to even the most rural areas.
It makes complete sense. So here in DC, there's a clinic that we deliver a solution to, and they provide they're multidisciplinary clinic. They have about 5 clinics in the DC, Maryland, and Virginia area, and it's truly they have a mental health component to their clinic, a family physician, and have all these different subspecialists in that clinic. Similar to a mini Kaiser Permanente one-stop shop kind of environment. And then we utilize our technology as a one-stop shop to be able to help these individuals that are in person, virtual, right? Well, again, it's an ongoing effort by this clinic, and the same sound as though needs to happen in Mississippi as well. That it is not just a one-time thing. Let's wash our hand clean. We brought you a technology that may actually solve the issue, but the technology is not as important as the people buying in and utilizing it.
Right.
As a scale to really meet people at their need. So those are critical things. And one of the things that I wanted to ask you too to leave with this is, if you must have a billboard, what will be the take-home message?
For me, I'm all about empowering communities. And so my billboard would probably say something, to the effect of, take charge of your own healthcare. Allow me to help you. Because I think until we get individuals to adopt chronic disease self-management, empower individuals to take care of themselves while they're at home, we're going to continue to see this cycle of chronic disease illness in a state like Mississippi and nationwide. We have to empower individuals to take care of themselves, but we have to ensure that those individuals have the resources to do so. And I think a lot of times in very poor, underserved communities, they don't have the resources. And I think the very first resource is to ensure that person has the knowledge, has the health literacy to make that first step towards being healthy.
Makes sense. So takeaway: be accountable for your own health. Ensure that individuals have the resources, healthcare providers, access to health technology, and making sure that it's a multidisciplinary approach to be able to increase access to care. It's not just one person. It takes a team effort to care for that individual. Those are the key components of the takeaway. So we thank you for being on the call with us today, to Dr. Jones. And this has been a really enlightening conversation, because I think you have to peel the layers when you have this conversation, and it seems as though there's a lot that goes on the South beyond just let's come and fix the problem. You need to really understand the local issues. So thank you for sharing what's happening in Mississippi.
You're quite welcome, and thank you for the invite to take part in this interview.
Over the years, humanity has been able to transform almost everything into modern-day technology. Despite the technological advancements of digital solutions everywhere, the healthcare industry has a lot of catching up to do. Innov Cares has a mission to bridge the gap between humanity and quality healthcare access through telemedicine. Imagine a world where you do not need to leave your home to be connected to a doctor, nurse practitioner, nurse, pharmacist, physiotherapist, and every other person on the healthcare team. Everything is done right from the convenience of your home. Innov Cares is a telehealth and wellness platform that brings affordable healthcare services to people wherever they are. All you need to stay connected is an internet connection on your phone. The platform ensures access to quality, all-round health solutions, such as health and disease specialists, lifestyle and wellness features, and lifestyle and wellness tips to prevent chronic diseases. InnovCares also offers services for sports coaches or team owners who would like to sign up their athletes for quick and quality health services. Besides getting the best health and lifestyle tips, athletes can get connected almost immediately to the right healthcare provider in the case of an emergency, such as a sustained injury. Furthermore, the providers at InnovCares make it a point to ensure that the recovery process is being followed up. Get rewards, join the health tribe, connect health devices, tick your action list, and spend more time with your healthcare team at InnovCares. Download your InnovCares app on Google Play Store or Apple Store now.